I can't breathe. Hey, Dr. Joe Wood coming at you here, author of the book Miracles in Minutes. One of the things I talk about in my book is to simplify health so that way people can help themselves and also maybe get a better understanding of what's going on in their body. When you talk about fitness, when you talk about pain, it actually goes down to some basic common denominators. One of them is breathing. And I'm going to show you a list of books I have here on my floor. I have Yoga Anatomy, I have the Shaolin Workout, I have the Naked Warrior, Master, The Secrets of the Super Strong, Stress Free for Good by Lushkin, Iron Shirt Qigong, Emotional Intelligence Anatomy Trains. Whether you're trying to become more intelligent, whether you're trying to perfect your martial arts, whether you want to be strong, whether you want a better anatomy practice, one of the common denominators of life is, can you breathe? And since we live in such a modern society, we sit so much and we're under so much stress that when someone's under stress, what they do is, and they hold their breath. And what happens is over time, the rib cage becomes stuck. So one of the other things I point out in my book, Miracles in Minutes, is another basic fundamental principle about the human body and about life. And it is squeeze, release, or in and out. So the heart will contract, it'll relax. The heart will contract, it'll relax. Food comes in, food goes out. Water comes in, water goes out. Air comes in, air goes out. Joints should fully contract and relax. Go in, go out. So the question is, if this is a normal specifications of the body, is it present when we look at our patients or we look at ourselves? So one of the things that people can do is, well, how do you know that you may have a breathing issue? If you have sleep apnea, if you're hypertensive, if you have anxiety, if you're depressed, if you're fatigued, if you're struggling to lose weight, those all point to signs that you can't breathe well. It doesn't mean you're not getting oxygen in your body, but it just means you may not be breathing well. When the allopathic side checks your pulse ox, they may register that you're getting oxygen in your body, but that's kind of like you asking me, I have $2 million in my bank account. It's present, it's there, but no one asked me how I got it. If I robbed a bank to get it, there's a good chance I can't keep it. So a lot of people are breathing ineffectively. They're using their neck muscles quite a bit, the splenius muscles up here, trying to lift this big rib cage up and down. And eventually that could cause neck pain, carpal tunnel, headaches, a numerous amount of symptoms. But instead of chasing the symptoms, the question is, can you breathe? So what you can look at is you can kind of feel, if your rib cage feels stuck, the ribs should be able to go down, contract, and then flare open. The ribs should open up underneath so the lungs can move out. But if your rib cage is held down all the time by tension, it's like me bear hugging you and you trying to breathe. So I'm going to show you a quick little exercise that you can do to start to improve your breathing. This will go into any sport. It'll go into anything that you want to do. Breathing is one of the essentials to life. Can you breathe? Can you move? Are the two connected? So, just showing you here real quick, is you can lay on the floor on your side, like so. Okay? So, now a lot of people do this in yoga. You can put a foam block between your knees to help that out. We also want to make sure that the knees are lined up. When the knees are lined up and pulled a little bit above 90 degrees, that actually helps to protect your back. If your head is dropping way down, you could put some pillows or something under your head. You should be able to relax here. Now, my focus is not necessarily on the turn of me turning my shoulders open. We don't want to really crank on your shoulder up here. The question is, how are my ribs doing? So you could put your hand right underneath your breast, and there's a muscle right there called the serratus anterior. It actually helps to lift that rib cage up and allow the lung underneath to be able to just expand. So what you're going to do is you're going to take in a nice deep breath, preferably through the nose. And think about where those ribs are, think about your ribs moving up away from you, and think about them expanding like so. Think about your ribs expanding and moving up. On the exhale, you want to suck in your belly button and think about that area then contracting and coming back down. All we're doing here is just using our breathing, our awareness, our consciousness to highlight that area and says, hey, is this moving the way it's designed to move? Are all these ribs in through here moving, or are they stuck? If they're stuck, you could have headaches, anxiety, weight gain, low back pain, neck pain, shoulder pain. So, breathe in, breathe out. Suck in that belly button. Feel it contract. And as you let go of the breath, you'll feel your body just turn on its own. The breath will take you there. And if we look at movement, if the breath can take us there versus the muscle, you don't have to work as hard. So life becomes easier. That's my tip for the day. Dr. Joe Wood, author of Miracles in Minutes. Thanks a lot.